Hi guys, welcome to our YouTube channel. Valeria here. Thank you for tuning in. And if you've not subscribed yet, you don't know what you're missing. We've got a lot of things in store. And like I said, you stand for promotions. If we have got any sponsors, then we will consider you first if you are someone who follows us on YouTube, because it would mean that you are so familiar with what we do and who we are as a training center. So our training center is called Home Life Care, and today it's not exactly a question that I'm going to be addressing on this video, but basically I'm going to be talking about our trainings. A lot of people who inquire or who send us texts wanting training, there is a lot of things that they do not know. So this is what I'm going to be trying to address today. So I'm going to start with home-based care because we offer quite a few trainings. So home-based care, who is it for? You may be sitting at home and you'll be thinking, should I do home-based care? Who is it designed for? So home-based care is designed for people who want to work with patients. It can be in a clinical setting, in a home setting. It can be a patient who has had surgery and then they are now released so that they can be taken care of at home. It can be in old age facilities. The sky is the limit. It can be in a doctor's office. You helping out in the prep room, you can as well. Home-based care equips you to be someone who can do that. So minimum entry for home-based care is grade 10. So it doesn't have anything to do with do you have matric, don't I have matric. To help another person, matric is not a requirement. But however, we do require you to be at least grade 10 so that there is English proficiency, the language proficiency, so that you can understand the read and write English, because the training is given in English. And then at Home Life Care, we have the privilege of working with different communities. So each community has got its own vibe. So you find that there are other communities whereby they look down on home-based care, others do not. You find that there's a community that has got, a lot of educational background, but they want to do caring because they've got a passion for it. Then you'll find other people who do home-based care for the money, so that they can earn a living. So however or why you would do home-based care, your reason is very valid. So it's not only for people who have got no education. That is highly incorrect. And as I have said in one of my prior videos, we have students who are having degrees in education, who are having, diplomas, who are doing HR, who are in different fields, but they feel that, I've got a passion for caring for others and becoming a healthcare worker, so they do the training. So sometimes it's very nice to have this information so that in case if you look down on something, or if you have been told about it, or if you have seen home-based carers in another setting, but you have never really understood what it's about, then this is the platform to get the correct information. So home-based care can be done by anyone, and it needs someone who is highly skilled for you to be operational or to operate as a home-based carer. It's not a profession that we take for granted because you'll be working with human beings. And then after someone does it, what do we as a training provider recommend? So we say home-based care, being a home-based carer, that is not the end of the road. You need to be a home-based carer who constantly improves themselves. You need to have a driver's license. You need to do other trainings, to specialize in other trainings, so that you are a complete package. So we always say at Home Life Care, develop things that no one else can take from you. So that is the training that is within you. So if you equip yourself, and then you will be very good to go. So you will often hear people saying, okay, will I get a job after this training? For you to widen the net, to make your chances beautiful and to make your chances more for getting a job, what you need to do is you need to be someone who continuously advances. So we recommend further studying. We recommend self-development. In fact, we even teach it in class that you're supposed to develop yourself. And then students who failed matric, there's a blessing in redoing your stuff. So you find that after our classes, a lot of people have been encouraged. They have picked up again the art of learning. Then they go on to further their studies. They go on to rewrite and resit their matric. And then they now advance and apply even to nursing colleges. So instead of just staying at home doing nothing, Home Life Care is the place to be, getting a training that opens your eyes to new things and new adventures and new opportunity. And then also we recommend that our students not only concentrate in care work after they are done, they can also venture into other trainings, into other sectors. So we have students who started, the training just looking for care, but then they discover, you know what, I did a nail course. You know what, I did a beauty therapy course. But what I was lacking was this thing that I have found at Home Life Care. The encouragement, the seeing that it's okay, because our students really thrive. So our students go on and they go into other professions as well. So that is us at Home Life Care. And then also we recommend employment. Looking for a job as a carer, we also recommend it. So those are our further recommendations. And then secondly, I'll go to HIV testing and counseling training. So there, no matric is required as well, because a matric is not the end of it, and matric is an exam that can be retaken. So not having matric or not having completed it is not an excuse to sit at home and do nothing. It's not an excuse not to open doors and go for other trainings, because you will be saying, I have got no matric. So we actually think that matric is used as an excuse for a lot of people not to advance and take the torch of education further. But then we need to stop with this excuse. You can be an HIV tester and counselor if you have the correct training, the correct certificate. A lot of entities need HIV testing and counseling people. So today in the morning, I was watching a video and a documentary, something that is happening in Australia. People are under the assumption that UK, since it will no longer be taking outside carers, they'll be employing from within. People think that this is the end of the world. But then UK is not the only country in the world where people can go. I loved it that I was watching something about Australia, and Australia has got a couple, guys, if I say a couple of places, understand me, where they focus on caring and HIV and AIDS. So imagine if you're an HIV tested, trained counselor, then it means the sky is the limit. You can go to countries abroad and you can actually get yourself a nice job. And apparently those jobs in Australia as well for the care homes, I think I got a list for about 50 homes. So they are job sponsored visas that you get. So the jobs are visa sponsored. So that's an amazing opportunity. But then how do you get to this place of being able to look at these opportunities? You need the training first. There's no shortcut there. There's no way you're going to skip trainings and skip the necessary training, and then you just get to a point whereby you are earning when you did not put in the work. So that is not realistic. That is what you're doing, then it is sad. So it's important for someone to equip themselves. Take every training that you can. Take every opportunity that you can, so that you know that your tomorrow is assured. Because when opportunities are coming as well, by the way, they do not tell you that, no, I'm coming. They can start coming and then you find that there's opportunities, there's the jobs, but I am not equipped for the job. And then that will be a sad situation as well. And then the next training that I want to talk about is first aid. It is also a very sad scenario that people have to come and book and register and consider it a skill, having, first aid. It's something that, when I have it, it's that thing. It's a very sad situation because, we live in homes. Matric, no matric, we went to school or we went to school, degrees or diplomas, even in the president's house, can you believe it that he has also emergencies? So if you are in a household where there is people, it's very important to have one person at least trained in first aid level 1 and be a certified first aid responder. This is very important because anything can happen. Imagine how many people pass away in households where they could have just been saved by someone who is trained. Our kids who are upcoming, the matrics, when you're still at matric, do a training, be a first aid responder. By the time you finish school, you know that, no, I'm a certified first aid responder. That opens up opportunities and that saves lives. And then at Home Life Care, like I said, we don't work with only individuals that are, people assume that they've got no education. We work with companies, private and government companies as well, with this first aid certification. So we certify and we train first aiders, just individuals, and then we work with groups as well. Companies also send us their employees for us to train them and then certify them. So this can be for compliances. This can be for so that the company is seen as compliant. Old age homes, they need to be compliant with DSD. So we certify, we train first aid and we certify people. And then if you go on to train first aid level 2 and then first aid level 3, what it means is first aid level 3 teaches childbirth. You are someone who can assist if someone needs to give birth, you can assist. So the sky is the limit in this profession. It's a wide profession. And then when we come to our 2 other trainings, palliative care and dementia care, you find that in a lot of homes, old age homes, this is my experience because in Cape Town, I worked with more than 52 facilities in the Western Cape region. And then here in Gauteng, I'm working with facilities as well, and I'm entering into facilities and coming out when we do clinical visits. So you find that a lot of people working do not have a formal certification. So these are our refresher students. And then also these are people who are working with the elderly, but with no formal training. So it's important to have a formal training. So first aid, we work with individuals as well. Dementia care, we work with individuals, we work with groups. A lot of facilities call us in to train their employees on dementia care so that they can be certified. So these are the trainings that we offer at Home Life Care. And then we are busy with the ECD training. Watch the space. We will announce it when it commences, when we start offering it. So our training venues are in Eastras, is our head office, in Villages Avenue in Eastras. You are so welcome to book an appointment if you have got any training that you want. Trust us to make you competent. It is necessary. And the beauty of our training center is we don't take in students a lot at a time. We prefer to work with small numbers so that we can work with you one-on-one and we can have sessions with you. By the time we are done assessing you and certifying you, you are someone who is very, very competent. And then at the end of the training as well, we will equip you with information. We will give you a list of 39 agencies that are recognized, whereby you can attach yourself to them for future employment. If they have got any gigs, they will definitely call you. So this is for home-based care. So us directly, we're not an employer, but we facilitate for our students to get employment. And we recommend, we give you a letter of recommendation. Facility gives us a letter of recommendation as well, so you know that you are a formally trained person. And then I would like to thank you guys for tuning in. Like I say every day, I enjoy these interactions because people need information, the correct one. There may be someone there at home who is saying, this home-based care thing. Trust me, guys, I know it. I've seen it. We will have our children sitting in the corners of the street corners. Males, they are in corners, they are just loitering. When you can use that valuable time to attend a training and then you get a formal training, and then you are in the direction to even do better things in healthcare. So it's important that if you've got any time and you're not doing anything, attach yourself to a training provider. Go for a training, not necessarily home life care, because for us, I always say, those people who come to us are those people that have been ordained. We ordained to work with those people. So we don't just say, everyone, come, everyone. No, we do not believe that. We touch one life at a time. That is why our classes are very small, so that we can equip our student properly. And then with this said, don't forget to register for the June class. It's coming, and I'm so glad to announce that Istra's class as well. I was under the assumption that Aman's crowd class only is full, but I see that Istra's also is filling up. So see you in class at one of our training venues. We would love to meet you. Have a nice day. Bye.